At the beginning of July, it seemed as if we were winning the fight against COVID, with schools preparing to reopen, masks destined for extinction. But as August begins, there are frightening signs our COVID nightmare is far from over. The Delta variant, as contagious as chickenpox, is spreading fast. In parts of the country, emergency rooms are once again filling up. The death toll is expected to rise. And the CDC is once again recommending masks indoors in areas where transmission is high. The mask recommendation even applies to people who are fully vaccinated, because while they are unlikely to get severely ill, they can help spread the disease. This week, more than 100,000 new cases were reported in a single day for the first time in nearly 6 months. There is some good news. The pace of vaccinations is picking up, an average of 650,000 shots administered per day. That's a 21% increase in the last week. So where do we go from here? Is this a temporary setback or a deadly new trend? Dr. Anthony Fauci is here to help us make sense of it all. So, Dr. Fauci, thank you for joining us. Help me understand, are we headed towards a period once again where we're going to see lockdowns, businesses shutting down, masks routine for everybody, or is this potentially just a temporary setback?
John, I don't think we're going to see lockdowns. I think we have enough of the percentage of people in the country, not enough to crush the outbreak, but I believe enough to not allow us to get into the situation we were in last winter. But things are going to get worse. If you look at the acceleration of the number of cases, the 7-day average has gone up substantially. You know, what we really need to do, John, we say it over and over again, and it's the truth. We have 100 million people in this country who are eligible to be vaccinated, who are not getting vaccinated. We are seeing an outbreak of the unvaccinated. There's some breakthrough infections among vaccinated. You expect that because no vaccine is 100% effective. But in the breakthrough infections, they are mostly mild or without symptoms, whereas the unvaccinated, who have a much, much, much greater chance of getting infected in the first place, are the ones that are vulnerable to getting severe illness that might lead to hospitalization and, in some cases, death. So we're looking not, I believe, to lockdown, but we're looking to some pain and suffering in the future because we're seeing the cases go up, which is the reason why we keep saying over and over again, the solution to this is get vaccinated, and this would not be happening.
And is this pain and suffering, for the most part, pain and suffering for those that have not been vaccinated? I mean, the bottom line here is, isn't it, that there are breakthrough infections for those that have been vaccinated, but you are highly unlikely to either be hospitalized or to die if you have been vaccinated. Isn't that right?
That is correct, John. There's no doubt about that. That's one of the really very, very important reasons you want people to get vaccinated. The vaccines are doing what they're supposed to do. They're protecting one from getting seriously ill, requiring hospitalizations, and perhaps even dying. However, when you have unvaccinated people getting infected, you're propagating the dynamics of the outbreak, which ultimately impacts everybody, from the standpoint of having to wear masks, from the standpoint of the safety of the kids in school, from the standpoint of being able to open up everything the way we were when we were normal. So yes, from the standpoint of illness, hospitalization, suffering, and death, the unvaccinated are the much more vulnerable because the vaccinated are protected from severe illness for the most part. But when you look at the country as a whole and getting us back to normal, the unvaccinated, by not being vaccinated, are allowing the propagation and the spread of the outbreak, which ultimately impacts everyone.
Okay, but walk me through this mask guidance. The CDC is now recommending, in certain circumstances, people that are fully vaccinated to wear masks indoors, even though you are highly unlikely to get either severely sick or to die if you have been vaccinated. So walk me through the science. Why this recommendation of masks for people that are fully vaccinated and unlikely to get very sick?
Right. All right. Masks for the fully vaccinated. The change and the modification of the guideline, which was formerly, if you were fully vaccinated, you did not need to wear a mask indoors or outdoors. The change, as we know now, is that even if you're fully vaccinated, when you are in an indoor setting in an area of the country that has a high or substantial degree of transmissibility, what we know as the orange and the red zones, you should wear a mask, even if you, in fact, are vaccinated. That has much more to do with transmission, John, in the sense of we know now that there are situations, as unusual as they are, but they occur. We hear about them all the time because no vaccine is 100% effective, which means in areas of high volume of infection, vaccinated people will get infected. Thank goodness, for the most part, they will not get seriously ill. They will generally be asymptomatic or mildly symptomatic. But we do know now with this very difficult Delta variant, it's different than the Alpha variant in a very important way. And the important way is that it's much more highly transmissible. And when you do get infected, even if you don't have symptoms, the level of virus in the nasopharynx is quite high. And in fact, recent studies have shown that the level of virus in the nasopharynx of a vaccinated person who may not be symptomatic or mildly symptomatic is the same as an unvaccinated person. And we know that vaccinated, asymptomatic, mildly symptomatic people who are infected can spread the infection. So you want them to wear a mask so that if, in fact, they do get infected, they don't spread it to vulnerable people.
We're almost out of time, but I want to ask you about the reaction we've seen from prominent Republican governors. We've seen Florida Republican Governor DeSantis, Republican Governor Abbott of Texas, Governor Ducey in Arizona push back strongly against the notion of mask requirements. Let me read you a quote from Governor Ducey in Arizona. He said, Arizona does not allow mask mandates, vaccine passports, or discrimination in schools based on who is or isn't vaccinated. They are arguing that this is individual responsibility and an individual's right to decide. What is your answer to these are Republican governors in some of the largest states in our country?
Well, John, I disagree with them. I respectfully disagree with them. The fact is, there are things that are individual responsibilities that one has, and there are things that have to do with you individually, which also impact others. And get the spread of infection that we're seeing now, the surge in cases, John, is impacting everyone in the country. So although you want to respect a person's individual right, when you're dealing with a public health situation, and we are, in fact, in a very serious public health challenge here with a pandemic, with a virus that has an extraordinary capability of spreading rapidly and efficiently from person to person. So a person's individual decision to not wear a mask not only impacts them, because if they get infected, even though they say it's my decision, if I get infected, I'll worry about that. But the fact is, if you get infected, even if you are without symptoms, you very well may infect another person who may be vulnerable, who may get seriously ill. So in essence, you are encroaching on their individual rights because you're making them vulnerable. So you could argue that situation both ways.
Okay. Dr. Fauci, thank you very much for sharing part of your Sunday with us.
Good to be with you, John. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.